BIRCH is building integrated readiness for community health, and the key objective of BIRCH was to enhance the design and effectiveness of existing and upcoming investment in community health by providing technical assistance to the Ministry of Health. The other key objective was to strengthen investment in community health, to accelerate progress on HIV, TB and malaria, and COVID-19 and pandemic preparedness.
So the challenges that we had as a country were centered around the implementation of community health activities in terms of finances. We didn't mobilize enough finances to implement our planned activities in the operational plan that were outlined within the service package. Also is one of the challenges that we still continue to face. We were in Monrovia, Liberia, when we were being told about the BIRCH project by one of our leads in terms of community health, Dr. Nicholas Elephant, who is based in Geneva. He told us that Zambia will receive support in line with the priorities that we've set. So that's how we knew about the BIRCH. And then they did ask us which organization we felt was best suited to handle the BIRCH project, and the name of Finance Alliance popped up. We had worked with Finance Alliance in the line of developing of Zambia first investment case for community health. So we saw it fit that Finance Alliance for Health can step in and pick up with the BIRCH project.
So in the implementation of BIRCH 1.0, we worked with partners like Africa CDC in terms of co-creating and developing the work plan. We worked with PATH, we worked with JAPIGO, Human Resource and Service Administration project. Then we worked with USAID Momentum. We worked with USAID Family Health and Nutrition. We worked with Health Runners. We worked with UNICEF Zambia country office. Then we also worked with different civil society organizations, as well as Churches Health Association of Zambia.
The first finance that was given to Zambia was $800,000 for 2023 implementation. And then for 2024, again, we've been rewarded and increased up to about close at $1.5 million. So the main goals for the BIRCH project, the first one, were twofold. So it was centered around technical assistance. It was also centered around technical assistance towards the proposal lighting for the Global Fund, GC7 and C19 RM. So that was the main technical assistance that the BIRCH project brought on board. Then the second objective was to help us implement certain activities that had been planned and had been prioritized but didn't have funding. So that informed the second objective. And then there is one objective that we have not done, that we haven't done well, but it's one of those that are centered around south-to-south learning. It was meant to do the cross-pollination of learning between Zambia and other countries where we can learn from. We have these two objectives. I would say that we've achieved them very well, and that's why we've been again awarded with a second BIRCH, which is for 2024.
First of all, I'm happy to mention that AFF, Africa Frontline First, was key to ensure that the funding for BIRCH 1.0 was unlocked. I'm proud of is the technical assistance we provided to the ministry in the Global Fund application process, which resulted into the ministry receiving a good share of funding through the C19 RM as well as the GC7. For GC7, it was 12.5 million. Then for C19 RM, it was $4.5 million for community health.
I may escalate it to multi-sectorial because when we have certain priorities that would want to be clean, for us we have a very strong technical working group that we normally sit together and look at the activities and then see which ones are most eminent here and which ones are very key for us. So it's very collaborative. So in the last 1 year, we have achieved a lot with the BIRCH project. If I say a lot, I mean, you remember I said the BIRCH support was centered around 3 objectives, but 2 were very eminent. We have achieved a lot in these 2 objectives. One of them was technical assistance towards the writing up of the GC7 and the C19 grant. So we had TA in terms of, to be very specific, the technical assistance that came with the BIRCH project was in form of costing. We had our priorities within the grant, and we had TA. We had TA personnel from the BIRCH who helped in terms of costing. When we do the narrations, the costing part was well done by the BIRCH, and so we were awarded community systems strengthening for both C19 and GC7. So we are talking about the sums. In the GC7, we are talking about $12.5 million that were awarded. And when we talk about the C19, we were awarded to closer to $4 million. So it was a success. The TA that was meant and the support that came from Finance Alliance towards the TA was perfect. It came at a time that we needed it, and we were able to achieve. So that's the biggest achievement that we had. And then again, the second objective was to look at the priorities that are already in the community health strategy and in the operational plan and implemented. These priorities, most of them lacked funding for us to kickstart. So we did set up these priorities for year 2023, and these activities were ably handled because of finances that came from the BIRCH project through the Finance Alliance, Financing Alliance for Health. So the objectives that were set were met.
Yeah, in the end, the achievements were one, the technical assistance which was provided in the GC7 application process. We saw the ministry getting a good share of Global Fund. Then under non-technical assistance, we saw a number of documents that were community strategic documents that were produced. The community health strategy 2022-2026, the advocacy and resource mobilization strategy, which was developed, the standard operation procedure for CBV medicines and medical supplies. So those are some of the exciting things that we will be doing in under BIRCH expansion. The take-home message is investing in community health, and particularly investing in community-based volunteers is a game changer in building integrated systems for community health.